Welcome back, MRHA listeners, to the MRHA podcast. I have special guest Pamela Williams on with me today. Pamela is an expert in a lot of things, but one of the things that she really wants to talk about is type 2 diabetes. So I will allow Pamela to introduce herself and give us a good background about type 2 diabetes.
Great, thank you. So again, my name is Pamela Williams, and I'm the director for the Cancer and Chronic Disease Bureau at the Maryland Department of Health. So I was really interested in talking about type 2 diabetes because it's a growing problem across the country, and Maryland is not unique in that. So we do have a growing number of people who are getting diagnosed with type 2 diabetes. And so just wanted to kind of give a little background of what diabetes is, and then also talk about the risk factors and the prevention programs that we have available. So diabetes is a chronic disease, so it affects the way the body handles the glucose. So that's the sugar in the blood that's used for the body for energy. And so what happens is the cells are not able to properly absorb the glucose, and this results in a high blood glucose levels, which is called diabetes. So we do have several types of diabetes, but the most common type is type 2 diabetes. And one of the things that just wanted to make people aware of is that with type 2 diabetes, it can be preventable. It can be slowed down if you follow certain protocols and prevention methods. But there are some risk factors for type 2 diabetes. So one of the major risk factors is prediabetes, which is a condition in which the blood sugar levels are higher than normal, but they're not high enough to be considered diabetes. And that's one of the silent cursors, that's what we call it, because it's often unrecognized by individuals and providers. Many times people may not have symptoms. And according to CDC, 9 out of 10 people have prediabetes and they do not know that they have it. And so with that diabetes and prediabetes, they can cause complications. So that can lead to stroke, heart disease, blindness, kidney disease, nerve damage, and amputation. So it's something that we're very concerned about. And then when we're looking at the data here in Maryland, what we're seeing is that about 10% of the population has diabetes. We have about 33% have prediabetes. And what we also are seeing is an increased number of people that are in overweight and obesity categories. And so that overweight and obesity population, that's one of the top risk factors for developing prediabetes and type 2 diabetes. So we are also seeing increased prevalence of diabetes among people who have sedentary lifestyles. We're seeing an increase in the rural jurisdictions. We're also seeing it among smokers, people with lower educational levels, health literacy, and disability. So those are few of the risk factors where we're seeing a higher diabetes prevalence. So with that, just wanted to talk through, there are programs that are available that focus on diabetes prevention and also diabetes management. So wanted to talk through some of the diabetes prevention. So when you think of prevention with diabetes, you're really looking at two things. We're looking at nutrition and we're looking at physical activity. So those are the two areas needed to reduce weight that can reduce the risk of developing prediabetes and diabetes. So what we have been doing at the state with MDH is really looking at various types of interventions. So one thing that we're looking at is our community-wide interventions. And so with that, we're looking at how do we develop policies on how to increase access to healthy nutrition and physical activity. Another area for diabetes prevention is our community healthcare interventions. And this is where we're promoting the National Diabetes Prevention Program. We call them DPPs. And this is a 1-year evidence-based program. It's lifestyle-based, and it helps prevent or delay the type 2 diabetes. So with this program, it does have a curriculum and they have a trained lifestyle coach. And what the research shows is that people who participate in the program, that lose that 5 to 7% of their body weight, and they also incorporate 150 minutes of exercise per week, they do cut their risk of developing type 2 diabetes by up to 58%. And if they're over 60 years old, it can increase up to 71%. So right now in Maryland, we do have approximately 120 diabetes prevention programs in Maryland that are available. So I'm encouraging people to participate. You can talk to the local health departments about DPP programs in your area. We're also providing funding throughout the state to increase the DPPs throughout the state, increasing the capacity. Other initiatives that we have been doing is funding the local health departments to develop overweight and obesity initiatives in their jurisdictions. So there's been a variety of programs that have been developed. So they include walking programs, community gardens, healthy weight, community-wide initiatives. So really looking at just developing these different lifestyle improvement programs that will help address the overweight and obesity. And then I also wanted to lastly talk about diabetes. Just because someone has diabetes, it's not a death sentence. So diabetes can be manageable, and we do have programs available for this population as well. So we have the Diabetes Self-Management Education and Support Program. And so it also has a curriculum and provides education to patients about their nutritional habits, exercise, and self-management. So we do have these different programs statewide as well. Many of them tend to be available through the hospitals. So just wanted to make sure everyone is aware of those programs. And that's pretty much all that I have to talk about with type 2 diabetes and the prevention programs, and also with prediabetes.
Well, thank you, Pamela, for giving us that great overview. I know that prediabetes and diabetes affects some members of my family, and my grandparents. I have a couple that take insulin daily and do blood sugar testing daily. So it definitely is impacting a big bulk of our population. And you mentioned that rural communities also are seeing kind of an uptick in some struggles just because some of the challenges that they have. And you mentioned a lot of great resources in the hospital system and health departments. Is there a place that if individuals are listening want to go find out more information, should they be visiting a particular website or contacting some of their local officials?
So they can go to our state Maryland Department of Health website. And so we do have within our Center for Chronic Disease Prevention and Control, we do have a diabetes webpage that has a list of resources that are available. And it's statewide, so it has resources available for each of the communities. And then also the local health departments of each of the counties, they also have a website as well. And most of them should have a diabetes webpage as well. And it talks through what programs are available within the community.
Great. Thank you so much for sharing those resources. We'll be happy to include some links in the description of the podcast so that individuals can find it. And, you mentioned some of the risk factors, obesity being one of them. We in Western Maryland have some community gardens that have been popping up. I know that the Eastern Shore is also working on some community gardens as well, which are great resources for individuals to lessen the risk of becoming diabetic, or if they're in the pre-diabetic stages, some ways for them to have healthier meals to limit, weight gain. And so thank you for highlighting all those great services to us. Is there anything else that you'd like to cover for individuals, both our membership and just general population, that should know about some of the services that MDH has to offer?
I think that's about all I have to cover that I have to talk about. Thank you.
Wonderful. Well, thank you so much, Pamela, for being on today. This is a great short episode with a lot of information packed into it. And so we thank you for being on. We'll make sure that we link all these resources in our description of the podcast that will be available on our social media pages and also on YouTube here very shortly. So thank you again, Pamela, and look forward for our next episode.
Okay, thank you.